DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. We're going to have a special guest today, Dr. Chris Rademacher from Iowa State's College of Veterinary Medicine and the Iowa Pork Industry Center right here at Iowa State University. We're going to talk about different things that are going on with swine health. We're glad you joined us today. Stay tuned.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson here with Dr. Chris Rademacher. Dr. Rademacher is a clinical professor in the Veterinary Diagnostic and Production Animal Medicine department at the College of Veterinary Medicine at Iowa State University, and he is now the director of the Iowa Pork Industry Center here at Iowa State University. And pretty much, if you want to know something about swine health, swine production, swine anything, Iowa State is the place to be, and this is our leader. And we're really, really thankful for all you do.
Yeah, I appreciate that, Dan.
Yep.
Glad to be on.
Great. And so we're going to jump into talking about PRRS. And I had a student one time wrote a paper about PRRS and spelled it P-U-R-R-S. And I said, close.
Close, right?
So this isn't cats.
That's right.
But PRRS is a syndrome in pigs.
Yeah, it's actually a porcine respiratory and reproductive syndrome virus. And really, if I think about it, it's the virus that's been kicking our rear end for about 35 years. It's been around for a long time. It's an RNA virus. Like it says in the name, right? It affects reproductively, so we see clinical signs in sow farms, abortions, stillborns, mummies, and then the unfortunate part about that is the damage doesn't just end there. It also affects the pigs downstream and causes respiratory disease and a whole lot of mortality. So, like I say, we've learned a lot. We've taught ourselves a lot about how we do it. The most frustrating thing about it is, I think as we've developed new management methods, we've got vaccines that are somewhat effective for it, and we've developed new techniques to help us control the virus better. But every time we do that, it's a little bit like Darwin's theory, right? We select for viruses, we select for a new strain that's a whole lot more virulent than the last one, and that starts to evade some of our methods that we're using to manage it. So it's really a very frustrating disease.
And on the beef side, BVD is very similar to as far as the clinical signs and outcomes. So what are some of the things that we're doing now when it comes to PRRS to help protect the herds and protect gilts and things
you bet. So a lot of it, we've gotten to the point, it's really talking about biosecurity, right? What can we do? We know it gets in pigs. What can we do to make sure we keep it out of our farms? We do a pretty good job in breeding herds. We put a lot of showers. We do a lot of washing transportation trucks. It's the growing pigs that we're probably not quite as good as. But we've actually gotten to the point, one of the more effective methods is actually to filter, MERV-style, hospital-style filtration systems into the sow farms. Yeah, to prevent it because it can get aerosolized. And once again, that's what we're seeing with this newer strain as we develop these newer strains that produce more virus in the aerosols. So because in particularly this time of year as it gets cold out, they actually stay alive longer outside the pig. They can travel. travel greater distances. So that's been one of the more probably more common things that we've done more recently to kind of help with some of that thing.
Yeah, and so vaccines, effectiveness,
Yeah.
where are we on that?
Yeah, we've had a vaccine that's been a modified live, been around really, probably in the first early years of it, and it does provide some protection. The problem is this is a single strain RNA virus, so it mutates and changes very rapidly. So it does, while it does provide some immune protection, it doesn't prevent against all strains. So it's kind of the deal where some protection is better than no protection, but we're not where we need to be. Eventually, we need to develop a new and better technology for that.
Yeah. And so what do you see as far as the future in PRRS? What about the genetically modified pigs?
Yeah, that's probably the most promising thing that we'll see. There's one genetic company that's done a gene-edited pig that will actually resist that, so they've got to get FDA approval, and then we'll watch that those genes get disseminated into the industry, and that'll be a whole new game for us. We'll see what happens then.
It's awesome. We're going to take a break. When we come back, we're going to talk more about swine health with Dr. Chris Rademacher.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Chris Rademacher, who is the director of the Iowa Pork Industry Center, and also he is a clinical professor in the VDPAM, Veterinary Diagnostic Production Animal Medicine Department at the College of Veterinary Medicine here at Iowa State University. And we're talking about PRRS, and we can roll into some research that y'all have done recently on sow mortality.
Yeah, so we, along with our colleagues at Kansas State and Purdue, we got a 5-year grant to study mortality of all phases. So my little slice of that big pie was we wanted to really look at sow mortality. We've seen sow mortality really increase since about 2014, kind of took an exponential leap, and due to many various factors. We see more pelvic organ prolapses than what we have in the past. Obviously there's been changes in genetics over that time. So one of the things that we wanted to look at was go on a farm and do a demonstration project with one of our swine producers here in Iowa, and it really was focused on a study that we had done back in my commercial production days. We had a summer intern just spend a whole summer in a farm, Monday through Friday. As they went in and dropped feed in the morning, she would follow behind and look at the sows that weren't eaten. And our directions to her were, we said, do a good clinical exam, write down your observations, and then treat them according to the SOP protocol that the veterinarian had. So she went ahead and did that, and what we saw was that farm probably averaged 6 to 7 dead sows a week, and she was there. It went to about 0 to 1 dead sows a week. Then she went back to school and went back to 6 to 7 dead sows a week, right? So just a small intern project, but always kind of stuck in the back of my mind, which was really to say, I wonder how much of that is we're just not detecting those at-risk sows early enough. And then by the time we do see them, and let's say they've got a really severe lameness, it's too late to really recover and save them. So that's what we tried to do. We spent 2 weeks on a commercial production farm just working with the gestation staff. So some colleagues of mine from the vet school, we just paired up one veterinarian with one of the gestation barn staff, and we went in because they feed those farms one time a day, 6 a.m. in the morning, right? Yep. So you have this unique opportunity because you get to see, since they're limit fed, whether they're eating or not. And that's really what we did. We just sat there and said, anything that doesn't get fed, that doesn't get up to eat, because they do get fed once a day, we said just flag them, because they're big. It was 4,000 sow farm, right? So there's like 1,000 sows in a building. You got about 30 minutes before they stand up, eat, and sit back down again, right? So we said just go through and flag them, and then what we'll do is after that, it took about a couple hours to do that. Then we'll come back up and get those sows up individually that didn't eat, didn't finish their food, do a good physical examination on them, and then we'll just treat them according to the treatment protocol. So we didn't do anything with their treatment protocol. They had great veterinary care there.
Yep.
We just think it's a situation we're not catching them early enough, and we're utilizing the fact that we can monitor their feed intake as that early signal to say, hey, there's something wrong here. So we went ahead and did that. Spent those 2 weeks with them, and then just kind of walked away from the farm, and we just monitored their weekly mortality. And really what we saw was that went from one of the worst mortality farms in the system to one of the best. They dropped about 4% in their annualized mortality. So that system saw that, went ahead and implemented it on their 30 other sow farms, and they've seen a 3% annualized drop in mortality across their entire system, just simply because they're taking their time in the morning. And we're short on labor, just like all the other industries are right now, right? And that's usually one of the things that gets dropped. And we said, hey, just take that opportunity. We know you're in there feed in the morning, just flag those animals, and when you come back later in the day after you have your breeding and heat checking done, just go through and flag those animals, take a look at them, and treat them. And sure enough, we saw great benefit from that. So it really was just about that individual animal care in those big farms, just kind of reiterating that's important. You got to look at every animal every day, make sure they're catching them early.
We just aired a show that showed that when you're feeding a bunch of calves, there's one that's laying out there by itself. That's the sick one. And
That's the
old adage of animals that are sick don't eat, and animals that don't eat get sick.
Yep, fits there perfectly, doesn't it?
It does. It's great. We're going to take a break. When we come back, we're going to talk about E. coli in the swine industry with Dr. Chris Rademacher. Thanks for watching.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Dr. Nels here, folks. We're super excited about this book on hiring. Have you made a bad hire? Have you hired someone you wish you wouldn't have? Are you looking to hire? It's a great short read on helping you in the hiring process. You can find it on Amazon, Kindle, Audible, or find it at drnels.com. Check it out there. We'd love to see you there.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Chris Rademacher, who has two hats here at Iowa State. One, he's a clinical professor of production animal medicine in the VDPAM department at the College of Veterinary Medicine, and he is also now our director of the Iowa Pork Industry Center that spans across our campus, tying together all different colleges, all different departments to help focus and serve the swine industry. And we were going to talk about E. coli, and so what are some of our major concerns when we think about E. coli?
Yeah. We have two strains that are probably the most predominant, K88 and F18. We had F18 early in my practice career, right? That's the one that causes edema disease, can cause really high nursery mortality. And then we kind of developed some low-tech, competitive exclusion products, the kind of stuff that veterinarians could culture in their basement type of stuff. But they've been very, very effective, so we've had a lot of people using those products for years, very effective against the F18 E. coli. But something changed about 3 to 4 years ago, and we can really see it when we look at our internal data and also the swine disease reporting system, which my collaborators over in VetMed have kind of put together. They take all the information from the top 5 labs: Iowa State, Minnesota, K-State, South Dakota State, and Ohio State. So you got 95% of the pig work gets done really in those 5 labs. All that information gets dumped, put together in a monthly report. So we started looking at that because we started hearing more about F18 E. coli again. And sure enough, since 2019, something changed. So we're starting to dig deeper in that. And what we're finding is some of these practices and these competitive exclusion products / vaccines aren't working as well. So something's probably changed with the E. coli. Now it looks like there's been some things that have changed. Obviously, the feed things are always challenging. So we're trying to simplify diets. That can get to be an issue sometimes. There really was a big push from a meat quality standpoint to the Duroc sire line of genetics. Before that, there was some Duroc out there, but there were a lot of white line, terminal bred sires. And within those lines, they had a lot of genetic resistance because of the late 1990 push when the F18 was more prevalent, right?
Dr. Harley Moon.
Yeah,
I mean,
exactly.
he taught us in veterinary school
That's right.
that the ones that had the receptors
That's
showed
exactly
up
right.
28 days post weaning.
You have it. You have it.
Yeah.
Some great foundational work, right?
Yeah.
So they started to put that into the selection matrix, and that was probably part of the reason why it kind of had gone back into the background. Well, because of some of the meat quality attributes that the packers were starting to demand, a lot of farmers, a lot of packers are putting pressure on the farmers to switch over to the Duroc, which haven't had that much genetic selection against the F18. And if we look at that kind of all occurred at the same time as companies and as producers started to switch over to Duroc. Well, lo and behold, now we're starting to see the F18 E. coli increase again as well.
So now we're back to probably looking at the genetic selection and starting to help fix it that way.
Yeah, yep. I think that's one thing. Certainly all the genetic companies are very attuned to that and will probably go back into their matrix. The other thing we started to look at is a closer look at the E. coli itself. I know some work here from my colleagues over in VetMed started to take some of the newer whole genome sequencing, all the CSI kind of stuff that we get to do in VetMed, started to look at the E. coli specifically, and they're starting to find this gene that's prevalent in human medicine. It's an attachment gene, which is different than the receptors that Dr. Moon talked to us about before. So we're starting to do some research to say, okay, we can find it. Does it really mean anything or not? If it does, it could mean, well, it could evade that receptor mechanism and it could attach by a different way. So,
I'll be dang.
Yep.
Well, one thing about it, they would say the bacteria were here before us and they'll be here after us.
They're pretty good at changing, adapting to change.
Unlike me. We're gonna take a break. We're here with Dr. Chris Rademacher at Iowa State University.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
We're the Iowa State University Beef Teaching Farm, and we're grateful to be part of an industry that's built on relationships.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here with Dr. Chris Rademacher. He's the director of the Iowa Pork Industry Center here at Iowa State University. He also serves as a clinical professor in VD-PAM over in the College of Veterinary Medicine, and he has brilliantly walked us through the health challenges of the swine industry, from abortions to sow mortality to nursery grower to now we're going to talk about feeder pigs.
That's right.
And so the name of the game is biosecurity.
Yeah, I think a lot of what we've learned, certainly with PRRS has probably been the greatest teacher for us from a biosecurity standpoint. And it really has been about how do we keep things out, okay? All about, a technical term that my colleague Dr. Holtkamp uses is, bioexclusion, right? How do you keep new things out from coming into your pigs? Now we're trying to start to look at it a little bit more globally to say, well, we know we have sites that break, okay? And we know that the site that breaks becomes the potential for other sites to get infected. So we're starting to look at things and what he coins the term as biocontainment. In other words, once the site gets infected, what can we do to keep that virus there and keep it from spreading to other sites? So.
And we've seen some of that, that the last barn you chore is the one with PRRS or the one with PED, and same way with us. The last cattle that we work are the high risk calves. We let the naive and the yearlings and things like that go through first, and
that's right.
And so kind of changing our day and changing our schedule to contain the disease.
That's exactly right. That's exactly what we're talking about. Because people think, well, I got to shower into a unit because I want to make sure I'm not dragging anything out. But then they get a little bit lazy about showering out, thinking, well, I got to go home or do something like that. What they're not realizing is, they can if they get lazy, they may drag some stuff and they drag it into their pickup. Their pickup of which goes into the next, number of sites. And if it gets, during this time of year where it gets cold, these viruses that we deal with, PRRS, PED, they survive well outside the body. While they jump in that truck the next morning, that virus sitting there on the floorboards could still be potentially infective. Now they just walk it back into the next site, right?
I've even, you talk about this, even carrying it in on your cell phone or carrying it in on different things, that we just hadn't thought about leaving those behind. And for cattle guys, we go to the sale and buy 5 head and throw them in the pen. Y'all would have a heart attack in the swine industry if we did that.
PRRS got rid of that for us.
But any other thoughts on biosecurity and some of the human aspects to it?
Yeah, so that's a lot of it. Just education. One thing that we really struggle with is trailer sanitation, right?
Yep.
Some of the trailers we wash after we haul, but we don't do all of them, right? And we get it, it's expensive, and we don't really have enough infrastructure to actually wash all the trailers even. But, as we're kind of sitting here with African swine fever approaching on our shores, those are all the types of discussions. I think what we really realize is that growing pig, that feeder pig, that finishing pig biosecurity, that's kind of our Achilles heel.
Yep.
So the Swine Health Information Center, they've just come out with a $2 million call with the FFAR to put together some proposals, right? Because they realize we got to come up with better solutions because, we just can't be that vulnerable, particularly with foreign animal disease this close.
Well, sure appreciate you taking the time. You're a busy guy.
My pleasure. I enjoy it.
That's great. It's great to have Dr. Chris Rademacher here on the show today. Thank you for watching DocTalk. If you want to know what we do, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson here with Dr. Chris Rademacher, and we'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.